All right, let's begin this bulletin first with the COVID-19 tally across India because numbers are increasing rapidly. It's even reaching new heights due to the rising Omicron cases in India. The worst hit cities are Delhi and Mumbai. But despite a dip also in some cases, the positivity remains high, which is over 30% now in the national capital. Mumbai also has seen a dip in cases, thankfully, in the last 24 hours. So here's a report now of how the cases are increasing and why we must not let our guard down anytime right now.
Rapidly surging Omicron cases, taking the overall COVID tally to fresh high. But the national capital on Sunday saw dip in daily cases. But positivity touched a scary high of 30%. Health Minister Satyendra Jain predicted that the downward trend will continue, despite 1 out of every 3 people getting tested turning out to be positive.
परसों के मुकाबले में कल केसेस काफ़ी कम है। पिछले 2 दिन से पहले एक बार 28,000 आए थे, फिर उसके बाद 24, फिर उसके बाद 20, तो लगातार तीसरा दिन था कि जिस दिन केसेस कम हो रहे थे। और आज का जो डाटा हम कंपाइल कर रहे हैं, जो शाम तक रिलीज किया जाएगा, उसमें लग रहा है 17,000 के केस लगभग आने चाहिए।
However, drop in cases can also be because of sharp decrease in COVID tests.
The reason of decreasing case, one of the reason is less testing. Yesterday, around 67,000 tests were conducted in the national capital. At the same time, the infection rate in the national capital is still more than 30%.
Maharashtra remains the top contributor to the COVID curve. But Mumbai, which is also the worst hit city, reported a dip in cases for yet another day, signaling what may be a plateauing of infections. Kerala, however, emerged as the new headache in COVID fight, with another sharp rise in cases. The sudden surge has forced the state government to announce fresh curbs. All public events have been banned. A maximum of 50 people are allowed to attend weddings or funerals. Any school or college with COVID cluster will be shut for 15 days. If experts are to be believed, next couple of weeks will be challenging for the country. The only way out is to follow the COVID norms and not drop your guard. With Sushant Mehra and Paras Dama, Bureau Report, India Today.
So let's bring you up to speed with what are the COVID cases in India. Remember, Maharashtra is still the worst hit state, reporting maximum numbers, and at about 42,462, that is where it stands. Karnataka closely following up now with Maharashtra, reporting a sudden spike, 32,793 cases. Also, let's take a look at national capital Delhi, that has been reporting a spike, but it appears the numbers have come down, 20,718, where Bengal at about 19,000, Tamil Nadu at about 23,000 now. States with most cases right now, we have the total of 2,71,202 with the Omicron plus the Delta variant cases. So let's get a quick update this Sunday from our colleagues from different cities. First, from the national capital Delhi, where Mohit Sharma is, also from Mumbai, which is reporting a high number, Saurabh Bhaktania. And let's also get an update from Bengal, Suryagni Roy, for all the latest. Mohit, first to you, because Delhi is reporting a high number, but the state health minister says it's not a peak just yet, in the sense that we need not panic. We are prepared, but the numbers are going to also come down. What are you picking up from Delhi, where curbs are still in place?
Well, absolutely. Pooja, the curbs are still in place. We are under a weekend lockdown, and it will continue till about Monday morning. More importantly, while the Delhi government has been coming out claiming that the numbers are still going down, and that's, we've also heard the health minister himself come out and say that it seems that the Delhi government has also received a lot of criticism over the lack in testing as well. Steadily over time, for the past 1 week or so, there has been a reduction in the number of tests, and that is something that the Delhi government is being criticized for. If you look at the positivity rate, it continues to grow at about 30.64 and above. Something that is a worrisome point here. Every third person that is being tested is testing positive. So clearly, the cases are there. And the opposition parties are, of course, taking no stone unturned to attack the Delhi government for the same. On the other hand, the Delhi government is assuring that since the hospitalization rate is still very less, people need not panic. But at the same time, there must be all precautionary measures which need to be taken. Masking up is a number one priority. Keeping social distancing and not to venture out until and unless absolutely necessary is something that the government is once again calling for. We've seen in the past that the Prime Minister himself had taken cognizance and taken stock of the situation along with review meetings that took place with the Chief Minister.
So review meetings are also on, yes, top officials that are indulging. Mohit, please stay on with me. Let's get a quick update also from Mumbai. Mumbai was reporting the highest number till now. Are restrictions still in place? What are you witnessing on streets? Saurabh, how are we expecting Mumbai to really react? We're all looking at Mumbai because if Mumbai's peak graph comes down, we can have that expectation from other cities.
Pooja, the BMC officials are telling us that peak is already over. So right now Mumbai is witnessing around 10,000 cases, which was earlier witnessing around 21,000 cases. The major concern right now, the number of deaths, Pooja. Yesterday Mumbai in last 24 hours witnessed over 11 deaths due to COVID-19, and this is the highest since July. That was the second wave in the pandemic. The another major concern right now is the home testing, Pooja. Let me tell you, over 70,000 testing were been done initially, but right now it has been dropped down to 55,000, and in the weekends, that is the Saturday and Sunday, the testing comes down very less. The major concern right now is also about the home testing. The BMC officials are going after the distributors and from distributors to the chemist. But to get the exact figure that how many people have already purchased the home testing kit is yet not known. Over lakhs of home testing kits have already been went to the houses, residential apartment. The BMC officials now have made mandatory that anyone who is purchasing the home testing kit have to submit their Aadhaar card, and the reports have to be updated online, and the BMC also has to be updated. So right now the BMC is not saying that the peak is over, that the cases are coming down. They are saying that till the time for the next few days they'll continuously monitor the situation. The restrictions which are placed earlier will remain to.
So Saurabh is telling us an interesting point that even the home testing kits will now be used not just for individuals to test, but also will have to submit reports. So we know if you're testing at home, are you also positive or negative, and that can be added to the tally. But there are some restrictions that are on in Mumbai. In Kolkata, Suryagini, Bengal is at about almost 19,064 cases to be specific. How is Bengal reacting? Has Chief Minister Mamata Banerjee and the district administration imposed any specific curbs that people must know as residents of Bengal?
Well, in the past couple of weeks, rather the last week itself, we had seen a huge surge of COVID cases. But thankfully, the last health bulletin of the 15th, showed a slight dip. So the cases have come, the active cases have come down to the daily cases have come down to a mark lower than 20,000, 19,000, as you rightly mentioned. Kolkata has seen a huge surge in the last week itself. Thankfully, it has come to some 4,000 plus cases in the past 24 hours. Now, when it comes to restrictions from the 3rd of January, there were multiple restrictions, but there were relaxations on it as well. Now, yesterday itself, the State Election Commission has deferred the polls of 4 civic bodies in West Bengal that were due on the 22nd of January, and it has been delayed till the 12th of February for almost 2-3 weeks right now, and that has happened due to the surge of COVID cases. But there has been some relaxations also that has been granted by the West Bengal government, wherein marriages and ceremonies can conduct these marriages with 200 people at a time. So at a time when the State Election Commission has deferred the dates of the elections of the municipal corporations, the government has come up with a few relaxations as well.
So some relaxations, but as our reporters are telling us, continue to keep your guard up. But there are some changes that district administrations are imposing. Remember, for Mohit, Saurabh, Suryagini, there have been no Sundays or Saturdays. They have been for the past 2 years consistently daily updating us, going out on the field to bring us the data of COVID-19. So you as a citizen viewer also must ensure to stay vaccinated and take all precautions. Thank you so much to all my colleagues for updating us with that information. But today is a special day. It was 1 year ago specifically that India rolled out one of the biggest vaccination drives in the world. It continues to be second in the list of most vaccinations worldwide, and the drive is a reflection, remember, of the relentless effort by the healthcare workers. And remember, for a country as massive and diverse as India, vaccination drive was no easy mission. This is a recap of India's Vax Drive 1 year on. Take a look.
From the first jab given to a sanitation worker to achieving over 92% first dose coverage and over 69% second dose coverage, India has come a long way in the last 1 year since the vaccination drive against COVID-19 began. On the 16th of January 2021, amidst much fanfare, India started administering vaccines against COVID-19. The move captured well by shutterbugs and replete with messaging that the vaccine is safe. The journey of the first dose to the over 156 crore doses in the last 1 year has seen several hits and misses. 1 year on, vaccine hesitancy has been replaced with a plateau in the demand for vaccines, while midway India dealt with vaccine eagerness.
सरकार बोल रही है वैक्सीन लगाइए,
जब मर जाते हैं तो आते हैं देखने के लिए, जब हॉस्पिटल पहुंचते हैं हम बेहोश हो जाते हैं तो आते हैं देखने के लिए.
A lot changed with the Prime Minister taking a shot of the vaccine, India's indigenous vaccine Covaxin, that was labelled by the opposition as the BJP's vaccine.
The scale and the pace at which the vaccination drive was rolled out and the staggering with the healthcare workers and the senior citizens getting the first priority was excellent. The CoWIN app has been functioning great, and it's really done wonders to coordinate and give real-time, very live and transparent data for the vaccination.
Covaxin, the vaccine in the eye of the storm, received emergency use listing by the WHO in November last year, making it the 7th vaccine in the world to get the nod from the World Health Body. In total, the WHO has approved only 9 vaccines for use against COVID.
It does affect, it does hurt, because we are not political people. We are only, our party is science. We breathe science. We want to do science. Nothing else we know it. We are neutral. So we want to do the best science. I think it does hurt. But for us, we have to look at the long run, what has to achieve for the country.
India's vaccination drive has been carried out in phases. 16th of January saw the vaccination drive for frontline workers and healthcare workers. The 1st of March onwards last year saw the elderly, those above the age of 60 take the dose, and those between the age of 45 to 60 get the dose. The 1st of May onwards saw India's adult population above the age of 18 start getting the dose against COVID-19. Vaccines for the adolescent population started on the 3rd of January early this year, and the additional dose for the vulnerable population started on the 10th of January this year itself. Experts say this has been timely.
The Omicron has been an eye-opener. We now realize that children are vulnerable, and countries like Cuba and China have gone ahead and vaccinated their 2- and 3-year-olds as well. So there is still a lot to catch on. The better part is that people who have been vaccinated have had milder disease and have had less morbidity and mortality compared to people who have been unvaccinated.
The last 1 year has seen several approvals for emergency use to vaccines. There are 8 vaccines that have received emergency use authorization in India. Serum Institute's Covishield, the most widely used vaccine in India, got an approval on the 3rd of January last year. Covaxin, developed by Bharat Biotech, got an approval the same day. Russia's Sputnik V, Moderna, Johnson & Johnson single-dose vaccine, Zydus Cadila Zycov-D, Covovax by the Serum Institute, and Corbevax, developed by Biologically, have an approval by the regulator. But only 2 vaccines continue to be the backbone of India's vaccination drive. The third, Sputnik V, has failed to take off in India, and Covaxin, an inactivated vaccine, has some manufacturing challenges in terms of the facilities also that are to be made available. It requires the BSL-3 facility, some of which have been improved essentially with the help of the government. Well, Covaxin is also the only vaccine that is being given to children in India. Zydus Cadila Zycov-D hasn't been rolled out. Pfizer and Moderna, in spite of the permissions granted, have not been able to enter the Indian market because of an agreement not being reached. Another hitch has been the delay in ordering vaccines. Last year, that was a great mistake, say experts.
We should have booked our vaccines in June, July 2020, when the initial vaccine candidates were ready and field trials were beginning. This would have helped us gain lot of months of early starting of the vaccination.
Experts say, in spite of the misses, India has a success story in the world's largest vaccine drive, given a push by the Har Ghar Dastak campaign.
I am very delighted to see that a country like ours with limited resources have been able to do such large vaccination program with more than 150 crore vaccinations given in such a short time.
To the Government of India and to the commitment of the healthcare workers, the providers and the people of India, that they have got these vaccinations, they have got themselves vaccinated, and that is why we can see that despite being in a severe another wave of COVID-19, we have practically minuscule fatalities, very less hospitalizations.
This is just the beginning. India's mission vaccination has now got a boost with the government rolling out the precaution dose. After all, vaccines are important weapons against the virus. In New Delhi, Sneha Mordani for India Today.
A face mask has been our best friend for the past 2 years. And as cases continue to rise in the United States of America, the Center for Disease Control has now issued new mask guidelines, including the best mask that you must use in the Omicron variant wave. Here's what you need to know about that.
The U.S. Centers for Disease Control and Prevention have revised their guidance for Americans on wearing masks to protect against COVID-19, recommending wearing, quote, the most protective mask you can and that you will wear consistently. But the agency stopped short of advocating nationwide usage of N95 respirators, which filter at least 95% of airborne particles, both large and small. A surgical mask, by comparison, is designed to protect others against virus particles that are breathed out. The agency on Friday said it wants to encourage Americans to wear masks rather than push them to wear the highest grade face protection, but also explicitly said that respirators provide the best level of protection, while, quote, loosely woven cloth products provide the least protection. N95 masks are flying off the conveyor belt at Protective Healthcare in Paterson, New Jersey, as the manufacturer ramps up production amidst the Omicron surge of the coronavirus in the U.S. The company's CEO, Brian Wolin, says demand is through the roof.
I've been saying since day one, if they could make these available to everyone on the planet, I personally believe that every problem that we had wouldn't be here at this particular time. Now, certainly, these weren't available in abundance back in 2020, but they are now.
The factory is operating 24/7 to manufacture 70,000 N95 respirators per day and plans to increase that number to 110,000 in the coming weeks as demand heats up. Critics have accused the CDC of offering shifting and confusing guidance throughout the pandemic regarding mask wearing. After announcing Thursday that the federal government plans to make high-quality masks available to Americans for free, the White House on Friday said the government will also begin shipping 500 million COVID-19 tests to Americans later this month without charge. COVID-19 infections in the U.S. are at their peak, with nearly 780,000 new infections reported each day.